Schizophrenia. Schizophrenia is a disorder of the brain affecting how one acts, thinks, and sees the world around him. Persons with schizophrenia have an altered perception of reality and may see or hear things that are not real, speak in strange ways, or feel that they are being spied on, and that others are trying to hurt them. This makes it difficult for them to function sometimes with normal activities of daily life. The word schizophrenia is taken from the Greek word schizo, meaning split, and phrene, meaning mind, indicating that it is a mental disorder in which the person is split off from reality. Sometimes it is confused with split mind or multiple personalities. Schizophrenia affects about 1% of the population. In women, it usually appears between the ages of 25 and 35 years of age, and in men, it usually appears between the ages of 15 and 25. Overall, schizophrenia most often appears in early adulthood or late adolescence, but then intensifies no matter at what age it is. There are quite a few common misconceptions about schizophrenia. Here are a few. It is a myth that schizophrenia means that a person has several different personalities. The fact is that schizophrenia is much more common than multiple personality disorder. A schizophrenic person is split off from reality. It is a myth that schizophrenia is a rare condition. Fact is, 1 out of every 100 persons is probably affected by the disease. It is also a myth that all schizophrenia-affected persons are dangerous to themselves or others. It is fact that most persons with schizophrenia are neither violent or present a danger to any persons. At times, however, delusional thoughts and hallucinations of schizophrenia can sometimes lead to dangerous, violent behavior. Another common myth is that there is no help available to people with schizophrenia. The fact is that the outlook for those suffering with schizophrenia is not hopeless. Many people with schizophrenia are able to enjoy life and function with their families and communities with treatment. People suffering from schizophrenia lose contact with reality. Their interpretation of reality differs from the norm. It changes the way they see the world and the way they feel, think, and act. They may remain in the same position for prolonged periods of time without moving or talking. Sometimes they don't make sense while talking, and they could potentially start believing that they are being watched, or that others are reading their mind, controlling their thoughts, or trying to harm them. Schizophrenic patients often hear or see things that do not exist. Schizophrenia can sometimes appear at once and develop rapidly, but usually it develops so slowly that for a long time the individual doesn't realize that they have an illness. People with schizophrenia tend to isolate themselves from other people and lose the capacity to pay attention to their appearance and other personal necessities. Causes. The exact cause of schizophrenia is not clearly understood, which makes it impossible to figure out any single cause. But certain factors that are believed to play a role in the development of schizophrenia are as the following. Genetic predisposition. Genes are considered to play an important role in the onset of schizophrenia, although no gene causes schizophrenia by itself. Research says that the risk of having the disorder increases in people who have a relative with this illness. According to studies, having a parent with schizophrenia means that there is a 10% risk of developing the condition, while having an identical twin with the disorder means a 40 to 65% risk. Environmental factors. In this case, environmental factors include all of the other factors other than genes, such as social, hormonal, nutritional, and chemical, and environmental in the mother's womb during pregnancy, as well as stress.
Hey guys, I just want to take a really quick second because I've been getting a lot of comments on my channel saying that the videos are going too fast and that I'm speaking too fast and too much information is being thrown at you. I want to kind of encourage you that it's completely normal if a lot of this is over your head, because this is way too much information to get in one setting. So this video is really meant to be watched more than once. Also, if you go to my website, which you can find a link below, you can find the audio version of this video, and you can also find nursing exam or NCLEX style questions related to this exact topic. So I just wanted to kind of throw this in there because I know that this method of learning works. What you're doing is you're putting information, just listening to it. Just try to stay a little bit relaxed while you're listening to it so it can sink in. So anyways, alright, back to the video, but I just wanted to throw this in there and I hope you enjoy it. Alright, I love you. I'll see you in a bit. Bye.
Felt in later years due to social dynamics, education, street use of drugs, vitamin use, viral exposure, and basically any other factor besides genes. Research shows that environmental factors infect the individual's inherited genes at higher risk and trigger the onset of the disorder. The onset of schizophrenia is a combined result of genetic tendencies and environmental factors during the developmental stage, i.e. pregnancy or early childhood. Adverse environmental factors, along with genetic predisposition, can cause disturbance in brain development, which makes the individual prone to developing schizophrenia. Then, during early childhood and also adolescence, environmental factors can either reduce the risk or elevate it further by harming the mind. Therefore, it is concluded that mental disorders, including schizophrenia, are the collective result of biological, psychological, and social factors, which is coined as the biopsychosocial model. Signs and symptoms. Signs and symptoms may differ in every patient, but all of the symptoms fall into three categories: positive, negative, and cognitive symptoms. Positive symptoms include behavior changes that are added by the disorder and which are not normally found in a healthy person, such as agitation. This is a state of increased irritability and tension. Hallucination, including visual, auditory, and olfactory, which means smell, gustatory, taste, and tactile, feel hallucinations, most of which is auditory hallucinations in which the person hears voices that are not really there. It is also the most serious one, as the voices are usually command hallucinations, which means it can compel them to act in violent acts such as hurting themselves or others, and they think they are obligated to obey the voices. Disorganized thinking. Thinking persons with schizophrenia lose the ability to track their thoughts and conversations. They may start talking about one topic and end with another topic, or respond to questions with irrelevant answers. Some forms of disorganized thinking or speech are neologism. This is making up words or phrases that only have meaning to the schizophrenic individual who created them. Clang, which means talking in rhymes even if it doesn't mean anything. Perseveration, which means repeating the same word or statements again and again. Loose associations, which means quickly changing the topics with no links between one thought to the next one. Delusions, false and illogic but firmly held beliefs because of the inability to differentiate between real and unreal experiences. Delusions of control, believing that external forces such as aliens are controlling their thoughts and actions. Delusions of reference, which means associating personal meaning to neutral events or things. For instance, believing that something on the TV or billboard is conveying a special message to them. Delusions of persecution, which is believing that someone is trying to harm or kidnap them. Delusions of grandeur, which means considering themselves as popular personality, such as Napoleon or Jesus, or believing they have supernatural powers, such as flying. Negative symptoms are the abilities that are lacking or missing in schizophrenic individuals but are present in normal people. These include lack of emotional response, lacking signs of emotions such as lack of facial expressions or restrictions or blank facial expressions, showing neither sadness nor happiness, monotone voice, and lacking eye contact, social withdrawal or depression, such as being unaware of their surroundings and or isolating themselves socially, lack of initiative or drive, lacking self-care and motivation, apathy, experience of emptiness, and being unable to follow through with any plans, cognitive symptoms are problems related to memory and concentration. These can include difficulty with concentration, difficulty understanding information and using it to make a decision, inability to use information immediately after learning it. Signs and symptoms differ for each individual. For some, it can appear suddenly. For others, it can develop gradually for certain patients. It can come and go as in a cycle of remission and relapse. Following are the early signs of schizophrenia: feeling uninterested towards important matters, angry, fearful, or illogical responses to loved ones, social withdrawal, inappropriate or unusual behavior, major change in personality, significant change in personal grooming and hygiene, lack of concentration and sleep, a constant feeling of being watched, seeing or hearing things that do not really exist, a decline in academic or work performance, nonsensical or strange way of thinking, of talking or writing, an obsession with an occult or religion, peculiar body positioning, subtypes. Based on the main and most prominent traits present in the schizophrenic individual, researchers and health professionals in psychiatry have divided schizophrenia into 5 subtypes. A schizophrenic individual may go through various subtypes over the course of their illness. These can include catatonic schizophrenia, paranoid schizophrenia, disorganized schizophrenia, residual schizophrenia, and undifferentiated schizophrenia. So let's go through each of these. Catatonic schizophrenia subtype is attributed with disturbances in movement as well as extreme behaviors such as a catatonic stupor, which is a dramatic reduction in activity. Catatonic excitement is characterized by hyperactivity or virtually all movements stopped and the affected person cannot move, respond, or speak. Overexcitement, in which the affected individual may mimic movements, which is called apopraxia, or sounds, which is called echolalia, around them. Paranoid schizophrenia, in which the affected person's emotional expression and intellectual performance may be quite normal, but the predominant attributes are auditory hallucinations and delusions regarding being targeted or mistreated or provoked by a person or association. Persons with paranoid schizophrenia may be argumentative, anxious, outrageous, and socially withdrawn. Disorganized schizophrenia, which is also called hebephrenic schizophrenia. The predominant attributes for this subtype are disorganized behavior and speech, and inappropriate or bland emotions, such as inappropriate laughter for no real reason, being lost in their own thoughts, or making irrational statements. These behaviors may also disturb the affected person's normal activities, such as cooking, dressing up, showering, etc. Residual schizophrenia. It is characterized by a history of severe schizophrenia in which the severity of the symptoms has reduced. The individual may still show unusual behavior and delusions and hallucinations, but with greatly reduced intensity compared to the serious phase of the disorder. Undifferentiated schizophrenia. This is when symptoms haven't developed completely or they are not clear enough to put into any of the other subtypes. Such causes are considered undifferentiated. Any affected person's symptoms can vary at different times, resulting in uncertainty of the correct subtype classification. Some may develop stable symptoms over time, but may not fit one subtype. In either case, the mixed clinical syndrome is classified as undifferentiated subtype. Diagnosis. So far, no tests have been developed to diagnose schizophrenia. So diagnoses are based on the appearance of the clinical symptoms. The person suspected to have the disorder is interviewed and observed by a mental health professional, such as a psychologist, psychiatrist, psychiatric nurse practitioner, or a clinical social worker. If there are symptoms of the disorder, the next step will be to rule out other possible causes or disorders, after which the person is diagnosed with schizophrenia. In order to get a clear picture, friends and family members of the person are also interviewed and observed. Sometimes making a diagnosis can be difficult for the mental health professionals. For example, if the mental patient is paranoid, they can resist the procedure and hide their symptoms, or they may not seek treatment or cooperate because they believe they are perfectly fine and don't require treatment. A person is diagnosed with schizophrenia based on the following evidences: presence of 2 or more of the following symptoms for at least 30 days. Delusions, hallucinations, catatonic or disorganized behavior, disorganized speech, negative symptoms, constant signs for schizophrenia for at least 6 months with active symptoms for at least 1 month, major decline in academic or work performance, or prominent changes in attitude towards others and one's own self. No other mental or medical disorder or substance abuse that could result in these symptoms. Medication and treatment. There is no cure developed for schizophrenia so far, but with proper lifelong care and regular treatment, some patients can live a healthy, productive life. However, if the treatment is not followed properly, the disorder gets severe at times, and the affected individual will need occasional mental health facilities for the rest of their lives. This treatment may include the following: medication. Treatment of schizophrenia and other similar mental disorders are mainly based on medication. One of the major obstacles to treatment of schizophrenia is non-compliance. Main types of medications used to treat schizophrenia are antipsychotics, neuroleptics, which controls as well as prevents symptoms of schizophrenia. There are 2 types of antipsychotic drugs: typical and atypical drugs. Typical drugs are the first-generation drugs. They are known to cause major and frequent neurological side effects. Atypical drugs are the second-generation medications that are comparatively newer. Typical drugs. Typical drugs include Haldol, Trilofan, Thorazine, Prolixin. Atypical drugs: Sapphirus, Clozaril, Abilify, Seroquel, Latuda, Risperidol, Invega, Fanapt, Geodon, and Zyprexa. Psychosocial interventions. Once a schizophrenic patient is stabilized with the help of medications, psychosocial interventions can be used to help them further in their day-to-day life. It can help clients deal with work, daily activities such as work, school, relationships, grooming, and communication. Patients who receive psychosocial treatment are more likely to cooperate and continue with their medications and have fewer chances of relapse. Some examples of psychosocial interventions are as the following: social skills training. It helps clients to improve their social interactions and communication skills. Individual therapy teaches clients stress management and identification of early signs of relapse, which can help them control it before it gets worse. Vocational rehabilitation and support employment. It helps schizophrenic patients by preparing them for jobs and assisting in finding and keeping jobs. Family therapy. It educates and increases awareness regarding schizophrenia in families that are dealing with this disorder. Alternative treatments for schizophrenia are highly effective, and they are improving day by day. A lot of clients with schizophrenia have been able to live a healthy life with diminished symptoms, with the help of proper treatment, regular medications, and a firm support system. Stay tuned, guys, because in the next few days, we're going to go over nursing exam or NCLEX style questions related to schizophrenia. If you would like to review some questions right now, you can click right here and go to my website. Enjoy the questions!